All right, welcome back everyone to the Texas A&M Dermatology Interest Group podcast. We're continuing our residency program series podcast here on YouTube. My name is Shiva. I'm a fourth year medical student at Texas A&M, and I have the honor and pleasure of having one of our alumni here. We have Dr. Nadia Alhamdi. She is a PGY2 at Mayo Clinic in Rochester, Minnesota. Welcome, Nadia. We're very happy to have you.
Shiva, thank you so much for having me. I'm so excited to be here.
Yay, awesome. Okay, so we'll just get right into the questions. First, we want to get to know you. So just tell us a little about yourself, your hometown, undergrad, med school, just the quick 1 minute elevator speech about yourself.
These are always the hardest. Like you said, alumni, I am a Texas native. My family is living in the Dallas area right now. I went to undergrad at University of Houston, go Cougs, and then med school was at Texas A&M. And I actually had the tremendous privilege to be able to get a little taste of all of the different campuses we had, Houston, Dallas, and Temple. And then now I'm here in Minnesota for residency. Oh, my apologies. I also did my intern year in Houston at Kingwood.
Okay, awesome. And then can you tell us, were you MD, PhD? Were you MD? Did you take a research year?
Yes, I did do MD PhD, so lots of research years.
Okay, and so then it was just the combined program at Texas A&M, or was it a separate PhD?
It was a combined at Texas A&M.
Okay. Awesome. All right. Well, it's also very cool that you got to experience all the campuses. That's unique, I feel like. Okay. And then tell us a little about your interests within dermatology and outside dermatology, what you do outside of the clinic as well.
So my interest in dermatology probably started when I was in the PhD lab, really interested in the immune system and kind of the microbiome and those interactions that we have with the skin. So I also am just drawn toward all of the autoimmune things as well. And then I think for derm, I do kind of plan on staying general right now. I'm pretty undifferentiated. So I think that that'll be fun to still get to enjoy all of the diverse things that derm has to offer. And outside of work, I actually live kind of close to this little lake. So I reinvigorated my love for running outside. And hopefully, when the weather is a little warmer and less windy, I might get back into cycling. And then, of course, just spoiling my cat, who's fortunately giving us some space right now.
Love it. I love all those activities. And then can you tell us what your PhD was in?
Um, Officially, it was in biomedical sciences, but I was within the microbial pathogenesis and immunology department, focusing on virology and pathogenesis and vaccine strategies against congenital CMV.
Wow. That is very impressive. Very cool. All right, so let's move from you to your institution. So tell us a little bit about Mayo, just kind of a general, where is it? How many residents do you have? How many faculty do you have? I feel like Mayo is a really big name. So um, we're envisioning like a huge hospital, but tell us, what does the Durham program look like? Is it hospital, clinic? What does it look like
Yeah,
today?
those are great questions. So the program itself has been around for a number of years. It's very well established. It's really figured out, I think, the best way to teach. And I think they really do a good job in terms of focusing on patient centered care and also kind of that idea and model of like learner teacher environment. So we do have 24 residents right now, usually about eight per class. And we have a few fellows. There's three derm surge or Mohs fellows. There's one to two pediatric fellows. And then we also have derm path. And I think the program is trying to open up a specific like complex med derm fellowship. And then the learner teacher ratio is just incredible. I feel like we're basically one-to-one as far as the number of faculty that we have that are consultants for our overlooking our clinical and hospital rotations. We do have a mix of both, which I think is um, pretty standard as far as derm residencies go. Obviously, it's a more clinical based practice and specialty. So a lot of your time is more clinical, but being able to get an idea of kind of the acute management of hospital based cases is really important for your training. And then something that I feel might be a little unique to the Mayo Clinic is that sometimes, kind of in a very unique circumstance, derm actually serves as the primary team for a hospital admission as opposed to just a consulting service. So it's kind of nice that you get the balance of both being a consultant where you can kind of, or a consulting service where you are, you know, being asked a little bit about the specifics within your field and kind of helping coordinate patient care versus being primary and kind of relying on the skills you learned during med school and intern year to really manage the patient and they are yours. So there's perks to both sides.
Wow, that's very cool. I didn't know that. Within the residency, so you said there's about 8 residents per class. Is it all just regular MD type of track, or are there research focused residents?
Great question. You ask the best ones. So we do typically have availability for a research track resident. Um, in that case, they would do 4 years instead of the 3 years concentrated on derm. We have one in the year ahead of me right now. So one of our PGY3s was research track, and he's actually also from Texas, but I won't give
Okay.
any other information.
Okay. And then well, you said that you did your intern year in Texas, so I'm assuming you don't have to do your intern year at Mayo if you match Mayo Derm.
That's correct.
Okay.
You don't have to, but there are options. So there's 2 categorical positions per year out of the 8. So it was kind of nice too to have at least a friend who knows the system. But if you wanted to stay closer to family or you had any other reasons that you either wanted to do your intern year separate from Mayo, they absolutely still take you.
Okay. Good. Awesome. So let's talk about research years, research fellowships for medical students. We know there's a Mayo Medical School, so they exist kind of nearby, I would assume. Um, is there a research year that is sponsored by Mayo, either formally or informally, that medical students partake in?
So I think when you're going through your ERAS options, you can choose to apply either derm categorical, derm with prelim categorical. Um, sorry, I guess it's derm advanced, derm categorical, which includes your prelim year, or you can do derm research track. Um, and that would be built into your application. So since
Okay.
I had already done research through med school, I didn't choose to go down that track, but I know a lot of people who kind of covered both and did apply for the research track as well as the traditional track.
Okay. Are there students who do like taking a break between second and third year or third and fourth year? And is there a faculty member that's in charge of like
Oh, I see
students
what
who
you're
want to
saying.
do a research year?
I think the way that our infrastructure is kind of set up, there isn't just a 1 year gap year research track. I think it's more on a volunteer basis in that situation, just because we do have a really high demand for research fellows, but most of them are international or have already gone and maybe they're coming back into derm or they're kind of bridging. They may be internal medicine trained or something else like that.
Okay. Uh, you may or may not know the answer to this because it's a little bit about admissions, but do you know if the people who are doing that, like the international medical graduate who's taking a couple years to do research with Mayo, does Mayo historically match these research fellows?
That's a great question. And I think it's a tough one because they have that built-in research track. So that's why, again, like that,
Got it.
just that one gap year is tricky. But if you did the the 4-year commitment where you're doing the research year built into your residency. Um, that's since they offer that option, I'm not sure the statistics on the other.
Okay, makes sense.
Sorry.
I feel like the next question you would definitely be able to give us some insight into. So, how does your program view people who did a PhD or who did a research year? Are you the only one there right now with an MD PhD, or just people who did research years in general coming from different institutions? What does the layout look like for you guys?
Great question. I actually do have a co-resident in my class who did a research year and has also an MPH. I want to make sure I'm not speaking incorrectly on that. I think he has a master in public health. Um, so we really greatly welcome, kind of the non-traditional student or anyone who has that kind of experience that they can bring to the table. And it definitely gives us all greater perspective to be able to work with each other and have somebody else's experience to be able to kind of collaborate with. And I think they're really good about that. And I want to say the statistics are probably pretty representative, where maybe a quarter of each class has kind of a extra research experience or degree, whether master's or PhD or otherwise.
Okay, awesome. And then is your institution, we talked a little bit about international medical graduates, but are they IMG friendly or DO friendly? Do you know of students who have matched?
I definitely know that I've known of some international med students who've matched. Absolutely.
Okay. Okay, but unknown about the DO.
Unknown.
Okay. Yeah, it's a little hard to know, I feel like,
It
past
is.
your own cohort of people. So, but just curious.
I
So,
know that we have hosted like visiting medical students. I just haven't been able to track down the match rate on that or if they have applied.
okay. So just wrapping up general stuff, we'll talk a little bit about away rotations. So, first is, do you know if away rotators are guaranteed interviews at Mayo?
I am so sorry that I don't have the insider knowledge on that yet.
It's okay.
And especially with the way that things have just been restructured, word on the street is that even programs that used to offer guarantees don't do it anymore now that we're kind of transitioning into the signaling structure of ERAS. And now that we have more signals available and there's gold and silver, but I definitely do know that they encourage signaling.
Okay. Awesome. Yeah, signaling, I feel like this is the second year we're doing it, and I feel like it's been very helpful, and it's definitely going to change the landscape of the match. But okay. And then looking at away rotations from a different light, from your current resident cohort, PGY twos, threes, and fours, are they all people who did an away rotation at Mayo, or does Mayo, look at non-away rotators the same?
I can speak to that on a personal note, but I think we've had 2 or 3 of my co-residents in my own class who did an away rotation here, um, out of the 8. And I personally was also one of the ones who didn't have that opportunity to come do an away rotation up here. And I still very fortunate to have matched. So I would say from personal experience as well as the larger picture that they do look at people who weren't necessarily able to come do an away.
Okay, awesome. And then last question, and again, you might not know the answer to this, but do you know how Mayo views geographic preferences at all? Because there's people who geo-preference, people who don't geo-preference, and then somewhere in between too, where they geo-preference another region, but then they're still applying to Mayo. Do you know any insight on that?
So I can't probably speak to the whole institution, um, but from my own personal, I think I set no preference and it worked. But of course, they do obviously not want to lose out on really great applicants who are really strong and that we do want to have here and who we might be kind of competing with like California or areas that have exceptionally nice weather and geography. So they definitely value family in terms of if you have a family or you have family ties that you really want to be near, they don't want to take you away from that. But they would love for you to bring your whole family with you, you know? And I think we are just very aware of how cold it is up here and that that can sometimes be a little bit of a detractor for some folks, which is totally reasonable. Like nobody up here wants people to just be miserable. Um, so I think as far as geographic signaling, the other advantage that Mayo does have is that it's Mayo Rochester, which is where I am. I'm sorry if I didn't answer that earlier, as well as the Arizona and the Florida campuses. So there are options for people who aren't really big fans of the cold. Those class sizes are a little bit smaller, but they do still do a tri-site conference with us. So all of our didactics are shared. And it's kind of like the A&M system where if I wanted to do a month elective in Arizona or Florida, it doesn't count as like an away or a leave of absence, but you have the opportunity to kind of just see how our own institution does medicine in a different geographic area of the country. So those are maybe some things that kind of didn't answer your question directly, but hopefully do somehow answer your question.
Yes, yeah, that is very helpful. I didn't know that. That's really cool that you still get access to these other cities, without having to go through a whole system, external type of system. So, okay, so our next big topic is training. So let's just start off with what the structure of your program is. Is it like a block system or a longitudinal system where every day changes? So just give us the general insight to what the structure looks like.
Great question. It's generally a block system, and kind of uniquely, I think our blocks are set in more of intervals of like 3 and 6 weeks instead of 1 month, which is really helpful in terms of, for example, your surgery block. You don't have only 1 month, and then as soon as you get the hang of holding the instruments, you're like on to your next rotation. I think those last 2 weeks really did make a big difference in just being able to get the your reps in and kind of feel better with your muscle memory. Um, and then some of the shorter blocks that are 3 weeks, you get peppered in throughout the year. So, for example, derm path might be one that lasts 3 weeks at a time, but it is longitudinally re-offered. So you might be on derm path every couple of months, but you're getting it in 3 week blocks, if that makes sense. So I think they kind of struck a really cool balance between something where it is a little bit of both.
Okay, cool. Do you get elective experience, and can you tell us a little bit about what those electives look like?
Yeah, great question. You do. And it's kind of a graduated system where first year we're still, you know, developing such a foundation in our learning that elective time is a little bit less than what you get as a second year. You get a ton of elective time. As a third year, you get a lot of elective time as well. But the main purpose of that is because a lot of the fellowship applications you have to really start thinking about during second year derm. And in that case, your electives are kind of there to help either build your interests or explore your interests or kind of build your resume. So my personal schedule, I don't think I have my elective time until very late in the year. I want to say May. And so I may be able to kind of start exploring my clinical interests with that. Or you can also use that as research elective, where you'd have time to really build a good project that you have a dedicated time to either writing or generating data or meeting with folks that you're collaborating with, things like that.
Okay, cool. Can you tell us a little bit about each clinical site? So, is there a VA? Is there a county hospital? Is it just one clinic? Is it multiple clinics? Where do you guys have to travel to, basically?
Great question. So for the Rochester campus, we have three main sites, I should say. There is the largely home base of the downtown hospital, the Mayo Hospital, where we are in one of the big tower buildings. And that is attached via Skybridge and subway system to the Rochester Methodist Hospital as a part of the Mayo Clinic. And that's kind of where you do your first year inpatient setting is at RMH. Then, as a second year, your hospital coverage is at the St. Mary's Hospital campus, which is probably like a 5 minute drive, if that. And on that campus, they have kind of the emergency department and a different level of acuity for your consults. So that's partly why they wait until your second year for you to be managing that, because you've got a little bit more confidence under you and a lot more knowledge. And then otherwise, a lot of the outpatient clinic is done in that main Mayo hospital, but we also have a community clinic, which also serves as our resident continuity clinic. So about once a week or more, I go to our Northwest clinic, which is local for Rochester patients. And it's kind of nice because then they don't have to go down to like the med center. And we also have the community rotation, which takes place at that site as well. We don't have a VA up here. The other hospital universities in Minnesota do the VA in the Twin Cities.
Okay, got it. Okay, and then where does pediatrics fall into this? Is there a children's hospital or is there a children's specific clinic?
Great question. We do have a children's or a pediatric specific rotation, but kids, I think, can come in to either the RMH or the St. Mary's Hospital as far as inpatient goes. And we do have outpatient pediatric visits in that main Mayo Hospital building. We have a ton of faculty who are actually very subspecialized in pediatric derm. And I think we have a specific pediatric vascular disorder elective, but also like just experience. We have a vascular clinic for pediatric patients. And so most of the higher acuity, higher complexity peds patients would be at that main hospital. But I have seen a few kids, technically kids, for acne visits at our community clinic too.
Okay. Okay. So with all these sites that we've listed off,
Yeah.
how far are they from each other? Is there a bus? Do you have to have a car? Can you walk? Is it across the street? What does the transportation look like?
Great question. And I'm going to draw parallels to College Station because I feel like at least for all of our Texas A&M folks, that'll be something that they can relate to. Rochester itself is a very drivable city. And I think that's one reason that it just felt so much like home when I got here, as opposed to as much as I love Houston and the big cities. Traffic is a lot more similar to College Station, but honestly still better because we don't have like the undergrad population that comes in. So I live about 8 minutes away from either campus and probably 5 minutes from the St. Mary's hospital. I'm also right across the street from a Mayo Clinic park and ride parking lot. So you can park your car and take the shuttle. We have really good shuttle services that I don't want to lie, but I want to say they go about every 15 minutes especially during peak times. There is a bus in town. I'm not familiar, I haven't taken it myself, but I mainly drive. And then I do have some colleagues who live closer to the downtown site and they walk like within half a mile. I probably know at least a quarter of the folks who can walk, or at least even if they live a couple blocks away, they can walk to the subway site and then they just take the underground tunnel for the rest of the short walk that it is. I kind of like being in that triangular area that I'm at where it's like I said, 10-minute drive to the Northwest campus, 8-minute drive to the downtown. So nothing really feels like you're ever kind of having to fight traffic or anything like that. And I'm probably going to take advantage of that shuttle service at that parking lot when it starts getting really snowy. That was kind of
Yeah.
my backup plan.
Yes, yeah. I always love those hospital shuttles. It's like you feel like so one with everyone, like all the nurses and students and residents and everyone are on the same shuttle. It's kind of unifying.
Exactly.
Okay, so I'm going to ask the age-old question that everyone asks, which is very I think, subjective to your experience. But so far, what would you say are the strengths of the program and the areas in which the program is making improvements?
Oh, that's a great question. So, I mean, strength, I feel like I could go on for another hour with you, but the first few that pop up are definitely our faculty and our co-residents. Um, I don't know how they got so many great, kind people to come to such a cold city and stay. Like that's the thing that I'm like, wow, it speaks to how good the place is that they're willing to like sit through 7 months of winter. Um, and I don't know if I am allowed to be saying this on YouTube, but like our program director just gave us all like these little hats to keep us warm in the winter. And like to come in on a Monday morning and get that when you're like, it's 32 degrees outside. This doesn't happen until January in Texas. I was like, they really do care about us. Um, and then just even, I mean, my own co-resident cohort, but even the other years, like there's just so much camaraderie and kindness and I think understanding and mentorship that just flows. And it's so fluid and comforting to know that you're really like it's still training, even though, you know, we like to say that Durham has different hours than maybe some other specialties, but it still has a way of being hard and challenging. And knowing that you're kind of going through this with a lot of really great people around you in the trenches is just kind of icing on the cake at the end of the day, I think. Um, Communication is great. The lectures are honestly outstanding. They're so fascinating. And they really do take, I think, an extra step that I think our program has is the global health partnership, where people who are interested in global health have the opportunity to apply for that in their third year, where you would do a project overseas or at a resource poor country of your choice. And I think that that ability to give back, but also set up a good infrastructure and like really teach kind of goes back to just those two main principles we talked about at the beginning of like patient centered care and like the value of learning and learning everything about medicine, but also humanity and just you as a professional overall. They really do value whatever goals you have, and they just want to help you get to the best part that you could be, you know, become the best doctor you can be and have the best career that you really want to achieve. As far as things in progress, as tough as it is to find one, I think we're just having some renovations going on, which is kind of exciting too. They're rebuilding our main floor. But I think everybody, as far as infrastructure, nursing, um, other supportive staff, faculty, like they're all very understanding and communicative about those changes, which sometimes I think as a resident can be frustrating when changes are happening and you feel like you don't really have an opinion. I feel like they're doing a really great job of like taking our thoughts into consideration.
Awesome. Okay. I love hearing that the residents get along and the faculty love the residents. I feel like that is really one of the most important parts of a program. And the hats are just, that's cute.
Like I almost went and put it on for this Zoom and I was like, that's a little too
Represent.
much. Yeah.
So cute.
So
Okay, so let's go into surgery. You mentioned your surgery experience is on 6-week blocks. You also mentioned you guys have three Mohs fellows. So tell us how much surgery experience you're getting. How early are you assisting? What does it look like with having three fellows there? And how often do you get to kind of scrub in for the surgeries?
great question. So in your first year, your surgery block is attempted to be structured more toward benign excisions and low risk, um, like basal cell, squamous cell on the trunk. Everything head and neck, big reconstructive Mohs cases are more structured into your second year surgery rotation. But that being said, we do have kind of a specialty outpatient block where you'll have days peppered in to your surgery where you're getting more surgery time. So even if you had like your 6 weeks are over or they're at another time, there is still that little element of integrative curriculum. And so even as a first year, first month, July, depending on your comfort, your demonstration of, appropriate technique and communication, you can be doing cases start to finish pretty early on with, yeah,
Okay.
benign cases, I'll say, like not face, not flaps.
Yeah.
And then that's largely kind of separated out from the fellows, but you staff with an attending or a consultant. And sometimes in the beginning, you're put on one of the seniors' calendars. So you're kind of assisting or tag teaming with them until you get the comfort level where they are learning how to teach you how to do it or learning how to supervise you. And so I think that's a really unique dynamic too, not only from the first year's perspective of getting honestly a lot of experience and exposure in a place even where we do have fellows, but even as a third year to be able to start thinking about how to train someone else to do it and really setting yourself up to becoming an attending. I think that's really great that they have that kind
Yeah.
of on the other side of it. And then your second year Mo's rotation is also 6 weeks. And that one here, we also take call. So for the whole surgery department, you would be kind of managing the pager and the after hours calls, which is great for knowing even your own kind of complication rate as far as, oh, I just closed this person this morning and now they're oozing or bleeding or something like that. Or knowing that they aren't. I think that that's really good to be able to have that kind of 24-hour follow up. And then apparently, I haven't done it yet myself, obviously, but they have a lot of faculty. So having 3 fellows does not slow you down at all as far as being able to really get out into the field. And some days you're still just one-to-one with a faculty while another fellow is with another faculty and the other fellows are with another faculty. And so it can really easily be into the, just thrown into the deep end fast. So study that book and be ready for your Mohs rotation because they'll let you show how much you've studied.
Yeah. It's
Yeah,
that's honestly very cool that even with three Mohs fellows, there's so much experience and so many patients that you can still be one-on-one. That's awesome.
yeah, yeah.
So let's touch quickly on cosmetics. Do you guys get any specific training, whether it's, official training or after hours training in cosmetics?
Yeah, so we do. We have a cosmetics and aesthetic medicine kind of department where scattered throughout your outpatient rotations, you'll be able to rotate through and actually get to see patients undergoing things like peels, Botox, laser. Um, and then we also, I think you can also build that into an elective with that time that we were talking about earlier. And we have both after hours and embedded into our curriculum, the cosmetic curriculum. And we actually just recently had our first one of that block. So that's actually really exciting. I think it's a graduated autonomy with the cosmetics as well. So um, first years, I think, can start doing non-facial Botox later on in the year where we would be doing like axilla and hands for hyperhidrosis, things like that. But by third year, you have the flexibility to be, having your own patients come see you for Botox and peels and things like that. So I think everybody really does at least graduate feeling really comfortable with all of the disciplines that we have in derm and the ability to kind of sprinkle all of that into your schedule. Um, Kind of speaking of the senior schedule, I will say that that's structured a little bit less blocky than ours is at this time, just because in the advantage of the blocks, as you know, for education is that you get that habit and you can really like let your brain develop the patterns that you're trying to learn. But as the third year, the curriculum is kind of more structural of what things would be like in practice. And so they may have, instead of blocks, kind of a more longitudinal structure where maybe they're managing a procedure clinic for a first year on a Monday, and then they're doing derm path on Tuesday, and then they've got cosmetic clinic Wednesday afternoon or something like that. And so then the rest of the week would be outpatient skin checks, community stuff like that. So they do have a little bit of a difference to that. And sorry, I didn't say that in the first.
No, that's fine. That's actually really cool. I think that's like it's kind of training you, t or I guess take the training wheels off and it's like, kind of forcing you to figure out how it is day to day as an attending, which is really cool.
Exactly. Yeah.
Speaking of that, do you guys have a continuity clinic? And when does that start?
Great question. We do, and it starts July 1st. Um, yeah, of your
Wow.
first year. So I think I had my first continuity clinic start. It was probably technically my second week just because of the way orientation fell on a Monday. But I do still get to see patients at least once a week or one half day a week, even on your busiest schedules for your continuity clinic.
Cool. Wow, that is awesome. July 1st. Get into it. That is great.
Yeah.
I love that. Okay, we touched a little bit on global health earlier, but tell us what that looks like. Just give us the details on if someone is interested, how Mayo supports them with the global health opportunities.
Great question. So we do have a good track record of people who've been able to complete a successful project. And so I think it's always good to like look at what's been successful in order to kind of figure out what Mayo would support. We definitely encourage people who are interested to, start early on either their interests or their project or their CV, just to be able to kind of demonstrate their interest in service and community service, and then kind of escalate it to the global community at large. And then you submit a proposal for a project. The department and I think the institution both look at it separately in committees. And then if you get approved, you get a pretty decent stipend for Mayo to help kind of offset the cost of the travel. And then typically the most projects are a 4-week project, but there are circumstances where if the proposal calls for it or it's allowable to still have a good tangible result and something where you're still making an everlasting impact in the community. I think there are the options to do projects as short as like 15 days. We do focus on resource poor countries because they do need they need those resources more. But we've had folks go to, I think, Kenya, Tanzania, lots of different options. And there are Mayo associated hospitals if you want to try to stay within the system, as opposed to kind of like branching out and really trailblazing and starting from ground zero as far as infrastructure goes. So I think it really depends on the person and your interest, but both are supported and encouraged.
Okay, cool. Last thing in the training, and then we'll go into research and community service. But can you tell us how call and the consult service work? Do you have like a month of consult? How does weekend and evening call work? What does that schedule look like?
Great question. So we have, at least for the consults on, yeah, both hospitals are 6-week block. But during that 6 weeks, you only cover every other weekend. So we have it kind of delineated where you are on for 12 days and then off for 2. So it's obviously ACGME compliant, but on the weekend call, we have kind of a certain set off time where if the consult comes in after that time, then as long as it's not an emergency, it's okay to see them the next day. And that stands for a Sunday as well. So if you're covering Sunday, if it's after a certain time, then you're allowed to kind of triage that and decide if it's appropriate to see the patient Monday instead. And if that's the case, you're completely okay to hand that off to your co-resident. Um, we have what's called a Jeopardy system for backup. So Jeopardy just means that you're the person who's kind of the first backup on call. And that person is the one who will take over the other weekends. So when I said you're on every other weekend during your hospital coverage, the Jeopardy person will kind of jump in And then we also kind of rotate through some other people too. I think as it stands with our class size, I think you only end up covering about 6 to 8 weekends overall the whole year, each year as a first and second year. And then they can 6 of those are already built into your block. So you really only have like 2 weekends otherwise that you're covering consults. We do have the luxury of some e-consults here too. So some of the consults you get will be a full consult, and then some will be like, hey, we think it's appropriate for you to be able to just chart check and then tell us your recommendations. So there's a mix of that. And then when you are on call, you've got the pager and getting, you have the pager on the whole time, like 24-hour, but it is home call. So if a page comes in and you chart check and it's okay to see the patient, the next morning, no one's expecting you to come in at 2 or 3 in the morning to go check a patient who's otherwise stable and their skin can be examined the next morning.
Okay. Okay. Awesome. So let's go into research and community service. We'll start with research. Tell us, are there any research requirements in Mayo per year or before you graduate or anything like that? We'll start there.
Great question. So just like every other ACGME requirement of having at least one scholarly activity per year, and I think ACGME also requires a QI project at some point during your training. Mayo obviously has those. And then first and second years are also required to present a case report at Minnesota Derm, which is annually in the beginning of September. I apologize. The process starts in the beginning of September. I think the actual presentation takes place sometime in the beginning of October. Um, so, but as a third year, you're no longer required to participate in Minnesota Derm. Otherwise, they don't really require anything extra. They're just very excited to support you. And if you want stuff on your CV, they're happy to help guide you there. But they do a really good job about telling us like it's okay to say no to a project. Like just because it comes up and you see something exciting and somebody says, hey, you want to write that up? If you're overwhelmed and you're project overloaded or you are just like patient note overloaded, then it's absolutely not frowned upon if that's not your career interest or you're not dying to do it.
Okay.
So yeah.
Okay, well, you kind of answered my next question, which was how much support do you get? And I would assume a lot just because you have the research track too, so there's probably a good amount of support. But that also leads into conferences. Do they pay for you to go to conferences, or what kind of financial perks do you have with publishing and everything with research?
Yeah, so I think that is something that has definitely driven my interest in research is the support for conferences that we have. And it's almost like unused income if you don't take advantage of it. Uh, I think Mayo is really fortunate that we're able to have up to 5 conferences per year supported by the program. Um, but I think there's some nuance to like it's 10 days or 5 different trips because they're
Right.
kind of averaging that you might do 2 days each. But we all know that AAD is, a fun conference to go to that's definitely longer than 2 days. So you can kind of mix and match. You do get support if you're presenting, absolutely. We do have kind of an extra system where you just submit your abstract for approval from the department, and then after that step, you're able to submit or present, I guess. And if you're presenting, you do get support financial for going to the conference. There is also one conference, I think, for your whole graduate years that you can attend without having to present. So a lot of people save that for their third year just to kind of have an idea of like, okay, I've gotten all my requirements out of the way and I really just want to sit and learn at this conference and not really have the stress of worrying about like, okay, but when it comes to my presentation, I'm going to be nervous about this or that. So a lot of seniors really enjoy that conference to the maximum because they're just able to just really take it all in and honestly network and kind of build those next steps where they're going to soon be attendings, just like a lot of the experts that are already there.
Yeah. Okay, cool. Okay, so community service. I think naturally we first think of, is there a free clinic? But then also, are there other, I know some residencies go to the food bank or do like skin cancer screenings with firefighters. Are there community service opportunities that residents are regularly involved in?
Yeah, absolutely. So we actually encourage it so much that we do require at least one community service, um, either a long-term project per year or I can't remember the number of short ones, but we have some community service requirements, um, just because it is such an important part of just being able to give back to the community and a good, space for learning for us and just getting that fulfillment. There is a student-run clinic that they're trying to get on the ground in Rochester, or if they have, they may have started it last year. It's pretty new. But other than that, there's also, like you mentioned, there are food banks and skin check clinics. And then I have to double check and see if this one is eligible for community service, but we do have the privilege as residents to give voluntary lectures or like wound care clinics or suture clinics to the med students. And I think that if you're involved in enough of those, I think that can count as kind of your service requirement too, because you are volunteering your time and it may not necessarily fall under any other category like education or leadership.
Okay. Okay, cool. Excited to see where this free clinic goes. It's always nice when there's a new free clinic and all the residents can help out. Okay, so let's talk about exam prep and didactics. First, what is the didactic schedule? Is it every morning, a dedicated half day? What does it look like for you guys?
Yeah, so we do have a dedicated half day. It's Monday morning. Um, and that goes through at least 12:30 most days, or at least that's what we're blocked off as. And then we also have a hospital case conference Thursday mornings before clinic. And then Thursday during the lunch hour, we have kind of our community or our clinic conference where we discuss interesting clinical cases. And then every probably at least every month on average, we do get some visiting professors who may give a lecture that can be a lecture usually on Friday morning before clinic, and then another lecture at the noon hour. Um, but those are pretty special circumstances. And it's also just so exciting to have an outside speaker kind of be able to bring in their perspective or their expertise on something. And then we do have every other Tuesday evening is our dedicated derm surgery curriculum, which will be usually about an hour. And then occasionally that time is also used for other curricula, like sometimes a skin of color journal club or another journal club, um, or occasionally maybe like a makeup lecture, like cosmetics or something that had to get shifted. Um, but I think in the next coming, it's kind of already in progress of trying to get more of our journal clubs built into the Monday morning curriculum. So we actually had we actually did have a successful and I think it was really well participated journal club, skin of color journal club, during Monday a couple of weeks ago. So I think the trial on that is going in the right direction for it to be a permanent adjustment.
Yeah. Okay, cool. And then do you guys get protected admin time at all, like a half day for research or just other like studying or administrative things?
Yeah, great question. So we are fortunate to have a lot of administrative support, which also means that since we're not doing a ton of like prior authorizations or callbacks on a regular basis. Some blocks do have that time built in and some just don't.
Okay.
So it's kind of block dependent, but it's also not fixed. Just to kind of contrast, I know maybe a lot of you guys are familiar with the Baylor Scott and White Temple program, where I think you got to have a fixed day or time that would be your administrative when you had it. Ours are assigned to us kind of on a weekly basis. So mine could be a Thursday afternoon during one block, or it could be a Tuesday morning on another block. It just kind of depends on a week by week basis.
Okay. Okay, good to know. Um, can you tell us who the program director is, who the chair is, just important leadership figures that we need to know within Mayo? And then I'll ask the specific question about faculty after.
Sure. So our program director is Dr. Carolyn Wieland. She is an absolute treasure. I mean, they're all amazing, but she's so kind and so thoughtful. And even just in a conversation with her, like you'll pick up on things that I want to learn how to emulate some of her communication skills. And then our assistant program director is Dr. Julio Sartori Valinati. We all call him Dr. Sartori. Also an incredible individual, really good at thinking outside the box. And then our chair is Dr. Mark Davis, who's another, like, I mean, they're just, I can't say enough good things about all these people. And he has kind of a particular expertise in erythromelalgia, which I think is just really cool that people, can come from all over the world to see him specifically.
Yeah. Yeah. And
Yeah,
it's not a bad thing to, say each person's name and then say who is also amazing and they're also amazing. That's really that's the best you can get. Um, are the faculty and program leadership in general responsive to resident feedback?
so much. And I think a lot of them, you know, it's really interesting to think that whether they're new faculty that kind of still remember their days as a resident or really well established faculty that still remember what it was like to be a resident, I think that that's just incredible. They've really collected, I mean, a great troop of people who know what it's like enough to really, empathize with us, I think, and respond to our feedback in ways that I never had even expected was possible.
Yeah. Okay. And then can you tell us the role that residents play in the interview and match process? Are all residents involved? Is it just the PGY2 class?
That's a great question. So I think we're just now starting to get that going. I will say the chiefs are always present in the interview process. I mean, I think everyone here so kindly remembers like, oh, I've interviewed with this person and this person. And like, we'll kind of have these shared experiences because we all interviewed with the chiefs and whoever staff to the point that we're like, yeah, they're literally, a big reason why I came here or whatever. And then they graduate by the time you get here and you're like, oh man, I never got to work with them, but maybe someday in the future. So I apologize that I haven't yet done any student interviews in order to kind of give you more information on that. But if you're okay with it, I can always keep you posted and update you with that once we get into that cycle in the year.
Yeah, yeah, we're excited to hear about it. Okay, so next few minutes are all the fun things, which is personalities and the vibe and what the residents are like. So give us a look into what the culture of the program is like. What are people's interests? What do people do? Are you guys going out to dinner together or hiking or, what is the general vibe of the residents?
Oh, that's too funny. And this comes at such a good time. So we do I would say get together pretty regularly. My class in particular had a get together around July 4th. Like as soon as we were here, we were like, all right, we got to get to know each other. But our department also hosts a kind of July 4th picnic where we got to know the other classes at the same time too. And then we have our department, actual like annual department picnic takes place either in August or September. And that's mainly because, like I told you, September was a blur. I don't remember when that was, but it was great. And then we also have a resident retreat that we like to do kind of at the beginning of the year so that we can all get to know each other. I know um, some places may do that kind of at the end of the year to celebrate your time together, but I kind of liked that we did it at the beginning so we could get to kind of set the tone and um, have that to kind of look back on throughout. I mean, some of us are still kind of like giggling about stuff that we learned about each other or games that we got to play. We are also kind of setting up to do a Halloween party as a group of residents. And I don't want to spoil anything about that. And I'm pretty sure we have some holiday plans already. Um, my cohort's also been really amazing and kind about kind of scheduling plans for people's birthdays or big milestones. Like we had a baby shower for one of our co-residents. And I think there's also well, there's a department fitness competition that we kind of strategically have had placed in like that January, February when everyone's just kind of hitting the middle of the winter blues and you want something to kind of rile you up and also focus on activity and self-health and wellness. And I think that that's really fun that they get into the competitive spirit and that we're kind of channeling that competitive energy that I think a lot of people in medicine and in derm specifically um, probably had to get here. And then instead of, making it a contest about whoever has the most pubs, it's who's got the most steps and, sweated the most. I think that's a way healthier way to do it.
Yeah.
Um, yeah.
That's
And then
awesome.
yeah.
Sorry, go ahead.
Oh, I was just going to say too, I think when there are conferences that everyone or a lot of people are going to, historically, and even from what I can tell happening right now, like people are so excited to, stay in the same hotels or carpool or ride share. And we always meet for dinners or brunches or things like that when we're, even if we're offsite at a conference in a different state or area, that people are just so excited to see each other that we still find a way to see each other outside of work.
Yeah, I love that.
Yeah.
That really is the best type of environment to work in. Um, do most people rent or own? I'm sure it's kind of a mix of renting and owning apartments and
That's
homes.
a yeah, good question too. So I think my class might be just barely tipped in the rent favored side of things. I know a few people who have bought a home. They generally have kind of their partner here as well, and may I think there's probably a confounding factor with dogs. It's the people who have dogs who have houses because they want to let them out in the yard and probably not feel the desire to like walk them up and down the block once it
Yeah.
gets cold. That's my suspicion. Um, but the housing, honestly, the cost of housing is so affordable here. It's very similar to College Station as far as the rent and the buying market, I would say. Um, it's just a very well established place, so it might be tough on a resident's budget to, build a new house from scratch. If you were going to buy, you'd probably be buying something that's already kind of been around. But the fortunate thing is that because it's kind of a hospital town in that July area where you're moving in, you've got residents and fellows who are moving out. So I don't think there's necessarily a um, bottleneck or a conflict for space either. So we've got plenty of space for new people.
Okay. And then just last thing, and then we'll do the concluding question after this. But tell us a little bit about, you just mentioned a baby shower. So I'm assuming there's single people, married people, people with kids. And do you know if there is support for maternity, paternity leave?
Yeah, so I think that's one thing that I really do admire from the program. There is birthing parent leave and non-birthing parent leave. Um, I think if you get into the very nitty gritty, you can kind of advocate for how much time you want or need. But I think we definitely meet the standards of 6 weeks for the birthing parent, and then I want to say at least 2 weeks for the non-birthing parent. Um, and other numbers, I like I said, can be kind of negotiated depending on what the overall year to year plan is. But lots of support. Lots of encouragement for you to be able to have not only the career that you want, but the home life that you want too.
Okay, love that. So, just a couple concluding questions. The first one, pretty quick and easy, but how can applicants find out more information? I know you guys have a website and an Instagram. Is there any other anything else you want to plug for us to stay connected with you guys?
I think those are our two main ones. You'll get a ton of information off of the website, and that's all definitely curated by folks who know this stuff like the back of their hands. Um, our Instagram page is pretty good for information too, and I know that our social media committee is really good about staying active and kind of keeping the content coming. And then otherwise, you know, anybody listening, I'll share my information with Shiva, but you guys are more than welcome to, reach out and ask individual questions. Or I think we have, I know Mayo as a whole hospital, I think they have some open houses. I can find out if we have any specifically with Durham. Um, but I think they also have probably contact information on our website for our program coordinators and our education department, like our EPCs. There's three really amazing. Everybody here, like I said, everybody here is just incredible, but they might also be able to kind of supplement some information for anybody who wants kind of additional info about like the curriculum or those questions like PTO and things like that.
Okay. And our last question is what advice do you have for medical students interested in dermatology in general and particularly in choosing a residency program?
My biggest advice, and you've probably heard me say this too several times, I think, is to really know yourself and think about everything that you want and everything that you would not be able to live without in your specialty. For some folks, that might be, as much as they love Mo's, they can't give up seeing the pediatric patients. And so that's just something to think about. And then I think really getting in touch with yourself about, do I love research or am I doing it because I feel like it's required? Could I dedicate that energy into something more productively that would make me feel fulfilled and energized, like community service? And I think that's something to definitely think about and to do. And of course, we have research requirements in residency because we still don't know enough, and you don't know if you're going to find something that you really are interested in academically or um, otherwise. And so I think, staying open minded, but also figuring out where you want to really dedicate your extra energy to is a good way to survive the training. And then as far as in choosing residency, you got to ask yourself where you're going to be the happiest. And it's such an individual question because you might value geography or prestige or being close to family or the people that you're working with and just knowing that they're going to treat you like a family themselves. So I think those are kind of the things is like really, really kind of take a selfish and put yourself first because wherever we end up, we're going to be training. It's going to get tough. It's going to have its challenges. And you don't want to be sitting there saying, oh, I wonder if I would have gone somewhere else. You really want to be in that boat where you're like, wow, I can't believe I get to learn how to do all of this and I get to do it here,
Yeah.
wherever that might be.
Yeah. Awesome. I always feel so inspired at the end of these interviews because it's just all the good advice. But thank you so much. We know you're super busy as a resident, and the hour you spent with us did not go unnoticed. So thank you for taking the time. And we miss you here at A&M. Hope
I
to
miss
see
you
you
guys too.
soon, maybe at AAD. But thank you to the listeners, and be sure to like and subscribe and share this with anyone else who's interested in dermatology or Mayo. All right. Have a good day.
Thank you so much again. Awesome to spend time with you.
Yeah, of course.